Hey, hi, my name is Irene, and welcome to my Disease of the Day presentation. Let's dive right in. So, the scenario goes like this. A 32-year-old woman comes to your office complaining of a yeast infection as she has noted a discharge, discomfort during urination, as well as some irritation in the genital area. As she's examined, a frothy yellow-green vaginal discharge with a strong odor is noted. What is most likely the reason for her symptoms? So this is what I thought at first. Could it be a yeast infection? That's usually caused by a fungus. Bacterial vaginosis, usually it's caused by the normal flora in the bacteria in women. But they have different symptoms in the sense of the discharge. The bacterial vaginosis usually is more of a white, clear discharge. Yeast infection is like a cottage cheese white discharge. Gonorrhea, chlamydia can have similar symptoms as well. Those are sexually transmitted diseases. Could it be a urinary tract infection? She did mention some symptoms that can be similar there, or could it be an allergic reaction of some sort? None of the above, honey. It is trichomoniasis. So this is caused by the stubborn protozoan, Trichomonas vaginalis. This guy here has flagella, so this allows it to attach into the vaginal wall, attaching to the cells, the healthy cells there, and inducing all of these symptoms. So that's what it looks like under the microscope once it's gram stained. So you can see it's like a little pear shape, and then it does have flagella around. So trick, they just commonly say it as trick. It's a common non-viral sexually transmitted infection, and it is caused by the flagellated protozoan. Okay, Trichomonas vaginalis. So let's go ahead and see what the transmission is. Basically, super simple since it is STI. It is transmitted primarily through sexual contact. So that's how it is, person to person, male to female, female to female, man to man. I mean, hey, it can be just transmitted via sexually, okay? It can also be transmitted from mother to child during childbirth if mama isn't treated beforehand. So we want to make sure to get her treated. Symptoms for women include the key was greenish, yellowish, frothy discharge. And it has a strong odor too. It's very distinct. So a lot of women that come in, I work at an outpatient clinic, work with a doctor. So we'll do a physical exam to determine, a pelvic exam to determine to see what we can do, what type of tests we can run. Usually with trichomoniasis, observed is the strawberry cervix. So as you can see, the cervix looks a little inflamed and it has those little tiny dots, like it's called petechiae, in the cervix. It's very distinct. So there's genital itching, burning, redness, soreness. It's very painful during urination or during sex. It can cause increased urinary frequency or even some spotting or bleeding after sex. As for men, men sometimes go without any symptoms. They also can get itching or irritation inside the penis and the urethra, and then they can have a thin white discharge from the penis, pain during sex or urination, or increased urinary frequency. So you can see how these symptoms can be confused for an array of other diagnoses, right? So the diagnostic test here is very common that we use in clinic, the nucleic acid amplification test, the NAAT. So we obtain that using a urine sample or a simple swab. We'll send it right off to the lab. Wet mount microscopy also, those we kind of phased out, but those are still done in some clinics. Again, a physical exam, rapid antigen tests. Culture is also a good method, but it takes longer. It can take up to 7 days, so we want to know ASAP. Um, Next, treatment. It is curable, so no vaccine needed since it's not a virus. This recommended treatment for trichomoniasis is oral. It's a pill. It's called metronidazole or trinidazole. I'm so sorry. I cannot pronounce these names properly. Effective against a wide array of anaerobic bacteria and protozoa by disrupting their DNA synthesis. So usually for women, I've seen doctors prescribe 500 milligrams of the metronidazole So twice a day for a week, and usually for men could be the same or just a higher dose as well. But we want to make sure when you contract this, you make sure you tell your partners, try to contain the spread of the disease, right? Prevention, get tested. Practice safe sex. Again, health is wealth. That's why I included that picture right there. Our health is everything. So we want to make sure that we're doing the best to get back to health and just be aware of these things. We live with a lot of microorganisms in this world. And again, our health is everything. And if we can learn more of what to do, what to do to prevent, again, that is the biggest thing. And these are my references. So a lot of it I got from the CDC website, and OpenStack's book was also a great resource. So thank you everyone for watching, and hope everyone has a great day. Thank you.